I'm Scott Weese. I'm a professor at the Ontario Veterinary College. Well, as a veterinarian, I've dealt with animals my whole career, obviously. And on the antibiotic side, it's something that we've always done because we treat animals. But as I've specialized in infectious diseases and focused on antibiotic resistance, we've realized that the things we've done in the past maybe aren't the best, and things we've done in the past maybe won't work as well because of resistance. So it's made me pay attention to how we use antibiotics and to try to figure out how we can improve our antibiotic use so we can keep using them and keep using them effectively. Well, for me, anything we can do to improve antibiotic use is the key. Antibiotic resistance has been called the silent pandemic. And if we look globally, it's estimated it's going to be killing tens of thousands of people, having trillions of dollars of economic impact over time. So it's a big deal. So it's a big deal globally, but it's also a big deal for me as someone who still consults on cases and takes care of patients. So whether it's the big issue of the pandemic or it's this animal that's in front of me that I need to treat, and maybe it's harder or I can't because it has a resistant bacterium, we want to head off these problems. So what we can do now to improve our antibiotic use can impact us now to make us do things better, but also can have big impacts down the road so we can keep access to antibiotics and keep effective therapies effective. The overall benefits are very broad. Obviously, people that use antibiotics can benefit from guidelines because it's guidance, right? We can see, okay, here's what we recommend. And it's not something you have to do or have to do in every case, but in general, these are some good ideas. So it helps with that day-to-day antibiotic use. And it helps with more probably towards the diseases we don't see as often. So we can use it to take a look at, okay, here's what I usually do. What are the recommendations now? Am I still kind of on par with recommendations? And also the disease I see less commonly, where I'm going to look something up. Okay, I'll figure out how I can treat this best. So I think it helps us at that initial level. And obviously, things that we do better to treat our patients have an impact on the animal's owner, on the farmer, if it's a food animal. And then you start getting to the downstream impacts. So the better I use antibiotics now, the less risk there's a resistance developing. And that benefits the owner and the farmer, anyone in contact with the animal, including me. And then, over time, as the resistance builds up, or if we can prevent it from building up, using these guidelines can help. Well, I think these guidelines are getting more refined because we're learning more. We're learning more about how to write guidelines for one thing, but we're learning more about how to treat animals better, and we're learning new issues and refining what we said in the past. So the guidelines have improved because we have better information there because of things that have been learned since the last version. Another big benefit is just availability. Guidelines that are available on paper are going to be less useful in general than guidelines that are available online. And the more we can get that in people's hands as a quick resource, because just human nature. If it's going to take me a half hour to find the book and find the right page and go somewhere, I'm not going to do it. If I can just flip it up online or bring it up on my phone, I can use it as a quick check when I might not have time otherwise. Yeah, well, we're always thinking about how to improve it in terms of how the guidelines are accessed, but the guidelines themselves. And guidelines can't be static because we learn, right? And that's good. Guidelines should change, and we should take that as a success. And some people say, well, you're telling us something different than you did 5 years ago. Well, that's good, right? Because we know more than we did 5 years ago. What we did 5 years ago was maybe okay, but now we can do it better. So these guidelines should be green. They should be updated all the time. And that's really the goal is as something new happens, then we can respond and we can respond quicker for things that are online and on apps than having to go through a formal process every 5 or 10 years and rewrite a paper document. So these can be a lot more nimble and adapt to changes a lot quicker. Well, anything point of care is what we're trying to do these days if we can, because it's just easier to use. Someone that's in on the farm with an animal, someone that's in an appointment with an animal, it's easy to bring up your phone and take a look or step aside and take a look, where it might be harder to go and look at another resource. So just that accessibility, because it's attached to us, is a big thing. And ease of use, that something we can find quickly is going to get used more. If I know that I can go 3 clicks and I know exactly where I'm going to find that information, whatever it is, I'm more likely to use it than if I have to go have to find the book or find the document that's laying around somewhere in my office. Then I've got to find the right page. And it's just, we're inherently not lazy, but we're inherently looking for stuff that'll make things more efficient and more effective. So the app helps that in a variety of reasons and helps us understand that we're getting the most recent information, because I don't need to worry if my book is from last year or 5 years ago or 10 years ago, or maybe out of date. When I'm using an app, I can assume that, okay, this is the best information that we have, so I can go by that. Well, we're just kind of starting to roll out some of these guidelines, and veterinary medicine hasn't had a lot of readily available app-based guidelines, and there have been a few out there that are more on the drug prescribing level, and this takes it to the next level. So we've got some information we can pull up quickly to say, okay, here's a dose for this, or here's what this drug is, but now we've got something that says actually how to use that drug in what circumstances, and which is relevant for our country and the diseases we see and the resistance that we see and the regulations for the antibiotics that we have. So having a Canadian version is very useful because we know the information is relevant to us, because we don't have many books that are written for Canadians. So the Canadian guidelines are a good thing. And then making them more accessible means that we can go to a handy, high quality, locally relevant resource. We can do it efficiently. And hopefully what we're trying to do is improve animal care. And we talk about antibiotic stewardship as this big package of, how do we improve antibiotic use? And for me, antibiotic stewardship is a patient care tool. We often think about it as being something, it's restricting what we do or trying to change what we do. And it's really not. It's trying to make us do things better for our animals, whether it's a farm animal, a companion animal. It lets us, use the things that we have more effectively so we get better outcomes for that animal or that owner or that farmer with a lower risk of complications. And those could be drug complications. They could be missing the proper treatment. And obviously antibiotic resistance is a big complication we're trying to avoid with these.